This is Dr. Jun Reyes, your physical therapist. I am based here sa New York. Ang ipapakita ko sa inyo ang tamang pag-treat ng shoulder impingement. Yung mga effective exercises na magpapagaling sa ating shoulder pain. Ano ba ang shoulder impingement? Ang shoulder impingement, ito yung the word itself, nagkakaroon ng pagkaipit dito sa tendon or bursa. Yung supraspinatus tendon. Usually masakit dito sa lateral side, dito sa gilid, at dito sa anterior area ng shoulder natin. Dahil nagkakaroon ng irritation secondary to overhead activities, lifting, repetitive motion, throwing activities. Yan, very common. 60%, more than 50% to 60% ng shoulder pain secondary sa shoulder impingement. Bakit? Nagkakaroon ng irritation or rubbing. So, nagkakaroon ng swelling dun sa tendon natin. So, every time na minumove natin ang shoulder, masakit dito sa anterior or dito sa side na yan. So, malaman, self-testing. Ituturo ko sa inyo self-testing para malaman kung may shoulder impingement tayo. Number 1 test, yung Hawkins test. Ilalagay natin shoulder flexion 90 degrees, elbow flexion 90 degrees, tapos internal rotation. Pagka may pain, i-move natin ang shoulder going this way, across the chest, i-rotate pa natin. Pagka may pain siya, that's positive sign para sa shoulder impingement. Okay, again, shoulder flexion, internal rotation, move your shoulder across the chest. Yan, pagka positive pain. Usually dito pa lang masakit na. So if there's pain, it's positive for shoulder impingement. Another test, yung tinatawag nating Neer Test. Yung Neer Test, shoulder flexion, yung thumb natin, i-move natin down, tapos possibly, or gamitin mo yung kabilang kamay, and then stretch the arm up. Pagka merong pain dito, or internal rotation, that's positive for impingement syndrome. Very common ito. Ang shoulder, kasi it's a complex joint. It moves in circumduction. Ito yung tinatawag na shoulder abduction, shoulder flexion, external rotation, internal rotation. Yan ang ginagawa ng ating shoulder. So very complex. It's a complex joint. Tayo mag-umpisa ng ating shoulder exercises para sa shoulder pain or shoulder impingement. Please make sure to like and share our videos at mag-subscribe na rin kayo sa aking YouTube channel. Gumaling ang shoulder impingement. Number 1, yung W stretching. Yung stretch natin yung chest muscles natin. So hold it for 5 seconds. Do this for 10 repetitions. Number 2 exercise is the pendulum exercise. Gagamit tayo ng 2 pounds dumbbell. And ang idea nito is, ipupull yung shoulder natin, down. So, may traction effect siya. So, malulusin up. So, you're gonna do like 30 seconds to a minute. So, I'm not using my arms. I'm just swaying my body. Ganyan. So, I'm just using gravity to pull the arm down para may traction. And then you can do this for 30 seconds. You can actually change motion. You can do circular motion. And it's actually a pain relief exercise. Nababawasan nga ang pain nito pag ginagawa mo siya for 30 seconds to a minute. And then you can do circular motion. You can do shoulder abduction. Alright, so as long as you're moving your trunk, not your shoulder, but your trunk, you say, I'm moving my trunk to move my shoulder. So this is a pain reliever exercise. Pag ginagamit ito ng mga pasyente ko, nababawasan yung pain nila, nag-i-increase yung range of motion. Ito yung number 3 exercise na tinatawag natin scapular retraction. Ang kailangan lang natin ay resistance band. So we're gonna do pull the resistance band and make sure you squeeze the shoulder blades together. Yeah. So hold it for 1 to 2 seconds and you do this 3 sets of 10. Okay. Yung pinaka-paborito kong shoulder impingement exercise, ang tinatawag na external rotation, internal rotation. Gagamit ulit tayo ng resistance band. Alright? So, ang gagawin natin, Make sure itong elbow natin nakadikit sa side ng ating trunk. Nakadikit lang dito. Make sure you don't do this way. Make sure nakadikit lang siya yung elbow sa ating side. So external rotation and then back. And just do it slowly. External rotation and then back. Ito naman tinatawag na shoulder internal rotation. Gamit pa rin ang resistance band. Nakadikit pa rin yung elbow sa ating trunk. I-move natin ang elbow inside. 2, 3, 4, 5. Again, 3 sets of 10. After 10 repetitions, you rest.